This one is kind of crazy. This story is really, really bonkers, and it is not out of Florida or California. I know you're going to ask right off the bat. So this is kind of along the lines of the True Malpractice series that we've been doing. I didn't think of it that way because this is just getting started. It's not ended, so we don't have like the end result. But this is a segment about a $25 million lawsuit over a woman who got an unneeded mastectomies, and it gets even worse. Wow, this one is pretty crazy. So it actually, and this is all the information I'm about to tell you comes from the news articles. A lot of this stuff is alleged, but there are court documents, so we're just reporting what's out there, folks. So it starts out a bit weird. Patient Mandy Moore had a deflated saline breast implant, all right? Decided she wanted to have her breast implants out. And this happened in 2023. So this went down a couple years ago. So it takes about that long for all the lawsuits and all that to kind of like show up. So she didn't go to a plastic surgeon, which is weird. I don't know why someone would not go to a plastic surgeon if they had a breast implant, because obviously the plastic surgeon put them in. She went to the Richmond Breast Center in Virginia. Did I say where it was? It's Virginia.
No.
Okay, Virginia. And now we know Virginia. Usually a lot of you don't get a lot of weird plastic surgery stories out of Virginia.
No.
I'm kind of disappointed in Virginia for this one. Went to the Richmond Breast Center, which that's also weird because when you talk about a breast center.
It's for cancer.
Yes, it is. Very good, Sarah. It's almost always for treating cancer or medical breast issues. It's never come get your breast lift or breast implants. Now, sometimes they will have a plastic surgeon on staff to help do the reconstructions. Not always, though. Most plastic surgeons, most breast centers don't employ a plastic surgeon. They just have some that they work with. Okay. So it is weird that she went to this breast center. Very, very weird. So she went in there, and this is, I watched the video of her talking. She's like, I just want to have my breast implants out. That's all I'm here for. Okay. Well, they did a couple studies, mammogram or whatever, and a nurse practitioner comes in and tells her, I got bad news. If you don't get a mastectomy right away, you are absolutely 100% going to get cancer. So this lady freaks out and basically gets allegedly talked into having mastectomies by a nurse practitioner, which makes no sense, gets hooked up with this surgeon, Dr. Espino. I've got a picture of Dr. Espino because she was on the news. I just kind of threw it up there if you want to see her. Yep, there's Dr. Espino. So Dr. Espino comes in just 5 days before the surgery schedules to meet the patient for the first time, which is weird because generally if something really big like, hey, you need to have mastectomy is about to go down, the surgeon would be the one that's talking to you, and apparently that's not how this one happened. So Dr. Espino takes this patient to surgery, and this is where it gets wild, and did both her mastectomies and her reconstruction, which is why that's weird because Dr. Espino is a general surgeon. She's not a plastic surgeon. She's not a plastic surgeon at all. She did what most general surgeons do, which is do a fellowship in breast, but that is a breast cancer fellowship. It has nothing to do with plastic surgery or reconstruction. And it's really wild that the hospital let her do that because there's no form or fashion that I can ever envision that she should have privileges to do breast reconstruction.
Right. She
didn't do training for breast reconstruction. She doesn't have board certification for breast reconstruction. So the hospital screwed the pooch big time on this one. As somebody who does malpractice consulting, they're screwed. This is a huge problem. There's no way that she should have privileges for breast recon. So, as would be expected with somebody who doesn't have training doing breast reconstruction, which by the way is very hard. I, at one point in my career, did a ton of breast reconstruction. I still do it. I don't do quite as much as I used to. It is very hard. It is much easier to do cosmetics. The reconstruction, because you're having mastectomies, is a shock to that area, and then you're trying to do a super complex surgery, and when you combine those two things of I'm traumatized in the area but then also doing something very complex, complications happen. It's very hard. You definitely don't want somebody that's not properly trained to do it. Well,
so she messed it up.
Yeah, it went badly. It didn't go into a ton of detail, but the implants ended up not where they're supposed to be. She had multiple reoperations. At one point, all her incisions broke down. I mean, it was apparently a 4-alarm goat rodeo. And And then one day the surgeon just didn't show up. It's like she like left town like suddenly. Yeah, right. So this poor lady gets all these surgeries. All of them went badly. And here comes the worst part. So she follows back up at the Richmond Breast Center, and she sees her new surgeon. You know, they hire a new surgeon. And this surgeon, I can't believe this, comes in and tells her, "You didn't need mastectomies. I looked at your chart, and I have no idea why that last surgeon did this to you. Like, there's nothing in your chart, in any of your tests that indicate that you're about to..."
What about the nurse practitioner? Where's she at? The one that told her that she needed it.
I mean, at the end of the day, it falls on the surgeon, you know, because the surgeon agreed with it, you know, that this lady needed to have mastectomies. And after someone who looked at it that was other than her said, "No, there's no way. Like, you have a slight risk increase of breast cancer." Like, she didn't have BRCA. That's the one thing I want to know is, like, did she have BRCA? No, she'd already been tested for BRCA, which BRCA is the breast cancer gene, which if you have BRCA, you need mastectomies yesterday, even if you're like 30 years old. Because when people get breast cancer with BRCA...
Isn't that what like Angelina Jolie did? She like tested
Angelina,
her...
I think she had BRCA. She was BRCA positive. Yeah,
yeah, she tested her genes when she had hers.
Yeah, if you have BRCA, you want to get... But she did not have BRCA. She didn't have any other the genes that are like high risk for breast cancer. She basically had like a slight family history of breast cancer, which means, okay, you have a little bit increased risk. But yeah, the surgeon basically came in and said, "I don't know what that surgeon was thinking, but you did not need all these surgeries that they did, which they did, and then they botched you." So obviously, she's very, very unhappy about all that.
Hopefully she's gonna
file a $25 million lawsuit.
Yeah.
Yeah, she did. In fact, the news company had an independent surgeon look at it, and they said the exact same thing. Or maybe he was like one of the experts like me. I don't know. It was a little fuzzy who this guy was, but they brought in a different surgeon that looked at the medical records and like, yeah, this is a total catastrophe. So, yeah. I have a lot of problems with this. I mean, I have two big problems. One, this lady got talked into surgery she didn't need. I don't think that there was any question about her not needing it. I mean, from what I looked at, from what was available, there was nothing really that would indicate she needed mastectomies at all. And I'm just, you know, I mean, I'm involved in breast cancer as a reconstruction, but I still have like some of the, you know, background and who needs what. And this lady didn't need that. So I hate that for her. She was coerced, probably for money. That's what I was going to ask.
I was like, is this to file insurance claims?
Yeah, of course. Yeah, absolutely.
They needed to do?
I mean, I don't know, but why else would someone coerce someone into having surgery? I mean, that's the only reason I can think of. I mean, is money. That's what the news people said. They were like, this was done for money. But then the worst part is
silly because it's like that should be something they do all the time. So it's just like
why coerce someone into? I have no idea. I mean, there are situations where surgeons get bonuses for production. I don't know. I mean, I'm not saying that's what happened, but you know, when you think of it like that, it's like, okay, if you do X number of surgeries in a year and you're going to get an extra 100K or whatever, then you're, you know, everything you see is somebody who needs surgery, maybe. I don't know.
Is it like hitting quota or something?
Maybe, yeah, quota. I mean, there are some of those contracts are, say, if you don't do enough that you don't get paid, or, you know, I mean, that's why I'm not an employee, because it gets really kind of sticky. But then the worst part is you have a general surgeon doing a surgery that they're absolutely not qualified to do. Like, I mean, what in the world? Like, why would that person think that they can do a reconstruction case? Like, she had no training in that. Like,
who's in charge of her?
Well, she's an employee of this place, but like the hospital should have prevented her from doing it.
What I'm saying.
The hospital. I mean, I catch flack from. There's one hospital I work at. I won't name them, but like they give me grief about doing stuff I've been doing for 15 years. You know, I actually had to go and fight with the administration about a case that I've done probably 30 times. I just hadn't done one recently, and they're like, "Yeah, you don't have privileges for that." I'm like, I'm a reconstruction surgeon. Like, and not only that, I've been doing reconstruction for 15 years in private practice. They're like, well, you know, and so like I'm getting grief for doing something that's like bread and butter plastic surgery and have to prove that, you know, I'm capable by producing numbers. And then you have another hospital that, yeah, sure, you want to do reconstruction? Yeah, go for it. You think you can do it? You can.
You interned somewhere for a week, so yeah, you can cut can cut somebody up.
Well,
no big deal.
I have a prediction that this case will not go to court. This will 100% settle, because neither that doctor nor the hospital, I think, is going to want this to go to court, because they look terrible, and they're going to fight it and lose. And so I bet they will probably settle out of court. Probably not for $25 million, but
yeah.
But that lady's getting paid.
And she'll probably have some good-looking boobs.
I don't know, man. It depends on how bad she got messed up. Yeah, it's crazy though. I don't know. I read stuff and I'm just like, how does that happen? But then you hear things like Dr. Death, that guy running around killing people, in Dallas.
Oh yeah.
That Dunch or whatever his name was. That guy's still in prison.
Really?
Yeah.
I watched that documentary.
Pretty wild.
Weird.
Yeah. Yeah. We listened to it in the OR one time when we were doing a long case.
Yeah, he was on drugs too, wasn't he?
Probably. Yeah, he was messed up. That guy was wild.